Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bone fracture versus break. Is there a difference? There is no difference between a bone fracture versus a break, they mean the same thing. Whether a bone has a hairline crack or is completely broken in two, an orthopedist or orthopedic surgeon will commonly refer to the injury as a break or fracture. /r/n/r/n. With that said, bone fractures can differ by their type, severity, location, and whether they are open or closed. These features can direct the appropriate course of treatment and predict how long the fracture will take to heal. /r/n/r/n. Bone fractures can range in severity from mild to permanently debilitating. As part of the workup, the healthcare provider will first assess whether a fracture is closed or open. By definition, /r/n/r/n. A bone fracture can also be described by the position of the broken ends. This is referred to as displacement or non-displacement. By definition, /r/n/r/n. The location of a bone fracture may be obvious, particularly when there is a compound fracture, but others may require an X-ray to find where the break, or multiple breaks, are. /r/n/r/n. In total, there are 206 bones in the adult body. These include long bones of the limbs, short bones like those of the wrist and ankles, flat bones like the skull and shoulder blades, and sesamoid bones like the kneecap that is embedded. /r/n/r/n. Bone fractures are commonly seen in these 5 parts of the body. /r/n/r/n. After the initial physical examination, an orthopedist or orthopedic surgeon will want to classify the fracture by the pattern of the break. As this may not be visible to the naked eye, an X-ray may be needed. /r/n/r/n. There are 7 main break patterns. /r/n/r/n. Based on these initial assessments, the orthopedist or orthopedic surgeon should be able to establish the cause of the fracture and determine the treatment plan. /r/n/r/n. Among some of the more common diagnoses, /r/n/r/n. Some bone fractures are obvious, while others may be subtle and easily confused with a sprain or strain. Some of the more common symptoms of a bone fracture include, /r/n/r/n. If you are unsure whether you have broken something or not, err on the side of caution and see a healthcare provider as soon as possible. Leaving a fracture untreated can cause far more serious problems in later life. /r/n/r/n. A bone fracture can be diagnosed by an orthopedist or orthopedic surgeon. Although it may be easy to tell that a bone is broken by looking at it, imaging tests are typically used to characterize the break and ensure no other injury is involved. /r/n/r/n. X-rays are usually sufficient for uncomplicated fractures. Complex breaks may require a computed tomography, CT, scan, which composites multiple X-ray images to generate a three-dimensional visualization of the break. /r/n/r/n. The treatment of a broken bone depends on which bone is fractured, how bad the injury is, and what your bone health and overall health are like. /r/n/r/n. Treatment of a fracture can involve /r/n/r/n. The healing time for a bone fracture depends on the location of the fracture, the severity and type of break, and your age and general health. /r/n/r/n. Generally speaking, bone fractures requiring casting take between 6 and 8 weeks to heal, although some like tibial fractures may take up to 24 weeks. /r/n/r/n. Bones may heal faster, while older adults may take longer to heal from a fracture. /r/n/r/n. If you take part in sports or other activities that put you at risk for broken bones, the best way to prevent fractures is to use the right protective gear. Examples include putting on shin guards when you play soccer and wearing a helmet when biking or horseback riding. /r/n/r/n. If you're at a high risk for a broken bone because of your health, for example, because you have weak bones from osteoporosisyou, you may need to take proactive steps to prevent falls. For instance, you may need to be extra careful when taking the stairs, remove throw rugs from your bedroom to prevent tripping, and sand or salt your driveway in icy weather to reduce your risk of slipping. /r/n/r/n A broken bone and a fracture are the same, the words are just used interchangeably. Whether your provider says you have a broken bone or a fracture, the treatment for the injury will be the same. However, the course of treatment will depend on how bad the break is, what type of fracture it is, and your overall health. /r/n/r/n You can prevent fractures by knowing the risks of your hobbies or sports activities and taking steps to prevent injuries. Also consider making changes in your home to protect against falls, and go about your day-to-day life with a mindset to guard against possible accidents, like wearing your seatbelt in the car. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.